Welcome back, class. This is Shelley. We are on Unit 14, which is the last unit of the semester, and Chapter 27 in your book. It has to do with end-of-life care. Palliative care is the type of care given to people who have serious chronic diseases such as cancer, AIDS, and congestive heart failure, as well as people who are dying. Goals of palliative care include controlling symptoms, reduce suffering, prevent side effects, maintain quality of life, and emphasize a holistic approach. Palliative care. Remember, palliative care works to manage the symptoms. It is comfort measures. They're not trying to cure the disease. Terminal illness is a disease or condition that will eventually cause death. Hospice care is often the next step. Hospice care, the goals of hospice care include, well, it's not a goal, but it's a fact. It's ordered by a physician for somebody who is suspected to only have 6 months or left to live. It can be given in a hospital, a care facility, or in the home, and it uses a holistic approach as well, focuses on the resident and the family as a unit. They give compassionate care, comfort care rather than cure, pain and symptom management, assistance for psychosocial needs, help family obtain financial counseling, and legal assistance. Why is it important for residents who are dying to have control over their lives as long as they are able? It's very important for them to feel independent as long as possible. Grief. Grief is a deeply emotional process that is a response to a loss. Grief includes physical, psychological, emotional, social, and spiritual reactions. Elizabeth Kubler-Ross, who is the author of On Death and Dying, which I believe was written in 1969, established 5 stages of grief. Denial is the first one, which is a refusal to believe that they are dying. Anger, which is a why me. Bargaining, which is yes, but let me do this first type of thing. Depression, need to mourn and review their lives, and acceptance is when they've accepted that they're dying and are preparing for their death. Remember, not every resident goes through all of these stages or goes through them in this exact order. Legal rights for dying. Number 1, they have the right to have visitors. It may be inconvenient to have visitors coming and going at odd hours, but when death is close, it is an emotional time for all those involved, so they are allowed visitors. The right to privacy. Privacy is a basic right, but why may privacy for visiting be even more important now? The right to be free from pain. It is very important to monitor dying residents for signs that they are in pain. If they can no longer speak, how else can you tell if a resident may be in pain? I can't call on you, but it would be body language and stuff like that, right? Okay, number 4, the right to honest and accurate information. Residents have the right to honest information about what is happening and what their diagnosis is. Refer medical questions that are outside your scope of practice to the nurse. Number 5, the right to refuse treatment. They have the right. Have you ever cared for someone who did not want more treatment? How did you feel about that? And yes, I have cared for people who didn't want blood transfusions, who, things like that, and you have to respect their wishes. Remember, whether we agree or disagree with the decisions, the choice is not ours, but belongs to the person involved. Care of the dying. And yes, this is a CNA's job. Some of them I'm telling this, and they're like, we have to do that. It's like, yes, you do. Room environment, adequate ventilation of the room. If there's photos, religious items, cards, keep them within reach. Fresh flowers may bother the residents, so remove if necessary. Do not wear perfume, cologne, or aftershave. Skin, nose, mouth care. Give frequent skin care. Bathe often. Change gowns and sheets often. Give incontinence care promptly. Turn and reposition often. Give oral care frequently. Offer ice chips and use lubricant on the nose and the mouth. Often when they're caring for the dying who has breathing problems, you're going to report gurgling or rattling. Chain stokes is a type of breathing where they alternate slow, irregular breaths followed by rapid, shallow breaths. Sometimes if they sound like they're gurgling or rattling, the nurse can give medicines to help dry up the secretions. Keep their head of the bed elevated and change positions as ordered. A lot of them will still be on oxygen. It's considered more of a comfort measure, and a humidifier may be used. Care of the dying with food and fluid issues. Feed residents slowly. Encourage fluids. Do not force residents to eat or drink. Report nausea, vomiting, and diarrhea. And again, keep the head of the bed elevated. Care for the dying, pain control and comfort. Pain control and pain relief is critical. Observe and report signs of pain. They may be connected to a PCA device, which is a pump where they can push a button and give themselves medicines, and they may go back and forth between being hot and being cold. So you're going to have to kind of take their cues and adjust blankets for temperature changes. Caring for dying diminished senses. You're going to keep the room softly lit without glare. Use alternate forms of communication, the communication boards, pictures, and hand gestures. Speak in a normal tone of voice and describe care that is being performed, but don't always expect an answer. And remember, it's important to note that the sense of hearing is one of the last senses to leave. So it's important you still talk to them even though you're not getting a response. Factors. Okay, we're going to stop there. And